Welcome to the Captain James A. Lovell Federal Healthcare Center, the first fully integrated VA and DoD healthcare facility in the nation. Designed to improve the efficiency of healthcare delivery for our patients, this project consolidates and enhances the resources of two North Chicago healthcare institutions to create a world-class, patient-centered healthcare system. The Captain James A. Lovell Federal Healthcare Center brings together the assets of the Navy and Department of Veterans Affairs to create a single, coordinated system that delivers quality medical and dental care. The system provides care to a wide range of patients, including Navy recruits, active duty patients, U.S. military veterans, and TRICARE eligible beneficiaries. It provides these services at branch clinics and community-based outpatient clinics throughout our coverage area, and at our main facility in North Chicago, Illinois, located 40 miles north of Chicago, Illinois, and 54 miles south of Milwaukee, Wisconsin. Services provided on an inpatient and outpatient basis range from the full spectrum of primary care services to specialty care services in cardiology, pulmonary care, orthopedics, optometry, women's health, dermatology, neurology, mental health, and more. At present, the FHCC employs over 2,900 full-time equivalent civilian and military employees across the enterprise.
It really started back in the early 2000s when it became clear that the present facility that we're in here, the 12-story Navy facility, Naval Hospital, needed to be replaced. In addition, there was excess capacity available at the North Chicago VA Medical Center at that time, which is less than a mile away from where we're at.
One of the things that I say to our staff is that if you own these two hospitals, what would you do? Well, in fact, as taxpayers, we do own these two hospitals, so it makes sense to bring together the resources of the best of both the VA and the DoD to provide care to both populations. One of the things that we say is that we're going to be serving pediatrics to geriatrics.
In other words, you can't get to the Veterans Affairs until you've been in the military, so this is really an expansion of the continuum of care.
The Captain James A. Lovell Federal Healthcare Center is the first initiative of its kind, supported by both congressional and presidential legislation. It represents a groundbreaking effort to provide care to those who honorably serve and have served our nation.
Both the Veterans Affairs, Mr. Sullivan, and myself realize that one of the biggest challenges we have is the culture.
We both have a rich history of serving our different populations, and it's about trying to find those things that we have in common, as well as understanding the differences and bringing together the best of both the VA and the Navy.
Those cultures also go beyond just the medical care. They involve things like electronic medical records, the fiscal systems that we have, the personnel management systems that we have, just the way that our organizational structures are set up. And what we're really doing is adapting the best from both to try to come up with what is the best solution for maintaining both a DoD and a VA mission here in North Chicago Great Lakes.